Okay, Chair Rob, we are live on YouTube.
Thank you. It is 1 o'clock, April 21st, and we're doing this meeting via Zoom. We will open the meeting, and could we please do roll call? You're on mute.
Sorry about that. Chair Rob,
Here.
Linda Fox,
Here.
Betsy Aiello,
Here.
Jim Barnes,
Here.
April Karin is excused, Leslie Biddleston,
Here.
Jennifer McClendon is also excused, Tom Verducci,
Here.
Janelle Woodward,
Here.
Michelle Kelly.
Here.
Thank you, and we have a quorum.
Thank you. We will move on to agenda item number 2. Those wishing to participate via the telephone, please dial 669-900-6833. The meeting ID number is 837-5512-3403. And when you get through that and they ask you for meeting ID, please enter the pound sign. That information can also be found on page 1 of the agenda that should be posted online. Do we have any public comment?
Yes, we do, Chair Rob. I'm getting the slide up right now. We have a decent amount right now. So one moment, everyone.
Okay. While we're waiting for that, I will give a reminder that public comment will be limited to 3 minutes. And please state and spell your name for the record when you get going.
As a reminder, Zoom is used for public comment only. This meeting is streaming live on the PEB YouTube channel if you wish to watch the PEB board meeting there. The YouTube link is located on the agenda. For those who have joined for public comment, your name or last 4 digits of the phone number will be announced. You'll be advised that you have been unmuted. As a reminder for those on the phone, please press *6 to unmute. Please slowly state and spell your name for the record and proceed with your comments. Kent Urban, you have permission to speak. Please slowly spell and state your name for the record.
Hi, this is Kent Irvin, K-E-N-T-E-R-V-I-N for the Nevada Faculty Alliance. Good afternoon, Chair Rob and board members. So we had pretty good news at the budget closing for PEB last week with restoration of the life insurance to pre-pandemic levels, as well as additional increments to the health savings accounts and health reimbursements accounts. So that's all good news. We were, of course, disappointed that the legislature did not restore long-term disability insurance, which we believe is an essential safety net for our state employees. We hope that that issue can still be worked on either during the session or in the future. And in general, as far as the legislative process, we really need to figure out how the legislature can do what it wants to do when it has good ideas about restoring benefits within the scheduling difficulties that the PEB fiscal year and plan year presents. Thank you.
Thank you. Robin V. Reedy, you have permission to speak. Please slowly state and spell your name for the record.
My name is Robin Reedy, R-O-B-I-N, R-E-E-D as in dog Y. Members of the board, I am the executive director of NAMI Nevada, the National Alliance on Mental Illness here in Nevada. I'm also a retiree of the state utilizing the benefits I have earned over 20 years working as both classified and in unclassified service for the state of Nevada. And I was primarily in finance, so numbers are my friend. In testimony given on SB 167, it was stated that 40% of those forced to go through a step therapy process for medications were successful. It was touted as if it was a good thing. 40% is only good if you are one of the 40% and it works for you. If you are in the majority of people for which it fails, you have wasted 6 months to 2 years of your life following step therapy and not getting well. It's even worse when it's psychiatric medications. The fact is, a psychotropic drug will map your brain so that a drug that might have worked if you took it first may not work after taking the different drug first. 40% that does not work when it's your granddaughter needing medication. Because of step therapy, she does not graduate from high school. A change in meds is the most dangerous time for an individual, and they ultimately go through a crisis, sending them to a higher cost care. It could mean a 72-hour hold or law enforcement intervention. And believe me, that cost of care for one individual in crisis could cost far more than the fiscal note presented. Anyone been to an ER lately and seen the bill? Imagine being stuck there because there are no beds in a mental health facility. I know of one dependent stuck for weeks during a mental health crisis in an ER because he lived with hemophilia as well, and no facility would or could take him. Definitely a higher cost than the fiscal note. I would like to gently remind everyone that PEBS is the public employees benefit system and should put the wants and needs of the employees above the pharmacy benefit managers that advise them. They want profit, and we all want to improve and save lives. Please support the cost of the fiscal note and do what is right for the employees of the state of Nevada. Thank you.
Thank you. Will Barry Cole, you have been unmuted. Please slowly state and spell your name for the record.
Good day. My name is Barry, B-A-R-R-Y, Cole, C-O-L-E. I've been a psychiatrist for about 40 years. When I look at step therapy, what I understand is months go by while we try to guess what medicine might work. It turns out the FDA actually tells us, based on science, what medicines do work and for what conditions. I understand that a pharmacy benefits manager might hope that a patient will respond 40% of the time to a generic medication. 60% of the time, they don't. And here's the sad part of this is that we know that with early intervention in psychotic illness, things like schizophrenia, severe bipolar, the sooner we can intervene effectively, the greater the probability of restoration. Each psychotic break presumably lowers one's recovery potential by 10%. 10 breaks, no chance of full recovery. So what we're looking for is using the right medications for the right patients at the right times. We're not saying everyone has to go on the most expensive medicine just because it's the newest, it's the shiniest. What we're saying is use published literature when there isn't a clear FDA indication to see what medications have been tried, what the effects have been. When the FDA has actually received trials data, and that's based on 2 independent studies that establish efficacy, we probably should get to these meds sooner rather than later and not withhold them. So I agree with many of the things Ms. Reedy just said. NAMI, the Nevada Psychiatric Association, the American Psychiatric Association, we all work for the betterment of people who suffer and live with mental illness. I hope that you'll support 167. I think it's the right legislation. Thank you.
Thank you.
Thank you.
Leah Case, you have been unmuted. Please slowly state and spell your name for the record.
Good afternoon, and thank you. Leah Case, Leacafe, here today on behalf of the Nevada Psychiatric Association. First, I would just like to say ditto to Ms. Reedy from NAMI, Nevada, and to Dr. Barry Cole. I think both of them made very salient points that are important to this discussion. The Nevada Psychiatric Association urges the PEB board to reconsider the fiscal note on SB 167. Just in looking at some of the supporting information in the bill tracking document for this meeting today, that impact to PEB states that there are 6,805 members that are currently taking at least one of the impacted drugs, and that in 37% of cases, patients found the less expensive alternative was effective, which means in 63% of the cases, patients had to get another doctor's appointment and get another medication. So 2,578 people were fine with the first medication or the less effective or the less expensive medication the first time. 4,287 patients, on the other hand, paid their $50 copay for that first doctor's visit, a $20 copay for the medication, and found it didn't work, and then had to go back to the doctor, which required scheduling. And as Robin said, this can take 6 months to 2 years to get in to see your doctor. So then they had to pay another $50 copay, and then $20, $40, or $150 copay for an additional medication, depending on where it is on the list. And patients are going back 2 and 3 times, or maybe they're not going back to their doctor and are instead ending up in the emergency department. Perhaps they need an ambulance ride because they're now in a mental health crisis. So we as the Nevada Psychiatric Association would urge the PEB board to take another look at the fiscal note submitted on SB 167 and just see if that impact is not offset by having folks on the right medication that first time. Thank you.
Thank you. Next, please.
Kate Crook, apologies if I mispronounced that. Please slowly state and spell your name for the record.
Good afternoon. My name is Kathleen Kruk, KATHLEEN and I have been an employee for the state of Nevada for 9 years. I'm here on my own time and with my own interests. I'm urging PEB to reconsider their fiscal note for SB 167. I understand that PEB is concerned about the potential costs that might happen. What is being missed here is the amount that it could honestly save PEB in the long run. I'm the mother of an amazing 17-year-old trans son. When he turned 13, his mental health started declining, and we had multiple suicide attempts. Max was hospitalized for the first time in December of 2018. His doctor prescribed him multiple medications that our pharmacy couldn't fill and told me to contact our benefits manager. After many hours and multiple phone calls, I was told that to get this med prescribed and paid for, he would have to try 2 to 3 other drugs first. Meds that treat psychosis take 4 to 8 weeks to hit a therapeutic level. If you do the math, trying 3 meds at 8 weeks per med, that's a 24-week delay of treatment. In that time, Max had 2 more stays at RBH and a stay for 6 weeks at a residential facility. I don't know the daily cost of treatment at RBH or Evolve, but I cannot imagine it to be less than treating the illness with the medications that were originally prescribed. Max is lucky to have family like us who will place him in the hospital when it is needed. There are people in Nevada that do not have the same support, who, while waiting 24 weeks for their meds to work, could have taken their own life. I personally have suffered from depression for the majority of my life, and in my early 20s, I was diagnosed with bipolar type 2. During a particular low point, my doctor prescribed a new antidepressant for me called Trintellix. The first 3 months of this went great. The med was working wonders and my doctor was able to provide samples for me, but the samples ran out. As I went to the pharmacy to have it filled, I was told to contact the insurance company again, at which time I was told that I was going to try 2 other antidepressants before them approving Trintellix. At this point, I opted to pay out of pocket for the medication because I was not willing to go on a med that I did not know would work when I was already on one that was currently working. The cost of this med out of pocket at the time was $476 a month. That's more than my car payment. Mental health medications is a key component in life or death game here, but other things were also at risk. My family's whole well-being could have been in jeopardy here. I was able to take FMLA to be able to leave and go to the extra doctor's appointments with my son and spend hours on the phone with an insurance company advocating for my child. I was able to do this without losing my job. Not all Nevadans have that luxury. If FMLA had not been an option for me, I would have lost my job, my insurance, and my housing, resulting in my sons and I having to be on public benefits in order to be able to survive. So while you're worried about the cost of one medication for one patient, the bigger cost without those medications is much, much larger. I urge you to reconsider the fiscal note on SB 167. Thank you.
Thank you. Next, please.
Carter Bundy, you have been unmuted. Please slowly state and spell your name for the record if you wish to make public comment.
Carter Bundy, CarterBundy, with AFSCME. I first want to thank the board and Director Rich. We know how much time and how much effort you put into trying to get and maintain the best healthcare for state employees, and we're grateful for that. We seem to be in a chicken and egg situation where RFPs are put out based on what we think the legislature will fund and the administration. And then we get to the legislative session, and because those RFPs are set, there's not a lot we can do to change the plan design, really nothing we can do. There are some standalone things that we're grateful for the legislature acting on, including life insurance and HSAs, HRAs. We do, to echo Dr. Irvin's point, we do think that long-term disability should be restored as well. But those are standalone things, and they can also help with premiums and subsidies. But at the end of the day, what we're finding is that we're constantly now in this trap where the RFP has been sent out, the plan has been designed, and our members can't afford to use what should be good healthcare, what is good healthcare in a lot of ways. But when the deductibles, copays, and coinsurance are so high, it makes it difficult for our members to use the very healthcare when they need it the most, and when earlier treatment would have prevented higher costs down the road. So what we hope we can do is start to have a 24-month engagement with PEB, with the administration, and with the legislature, so that PEB can start to explore restoring lower deductibles, restoring lower copays, restoring lower coinsurance in their RFPs, that we can do some costing out so that when it comes time to send out the RFPs, which is well before the session, we're not in a position where we're essentially enacting unusable healthcare. We want to be your partner with this. We want the legislature and administration to be partners with PEB as well. And we hope that by doing this next 24-month period, we can finally break this cycle and make healthcare affordable again for Nevada state employees. Thank you.
Thank you.
Brady Easterling, you have been unmuted. Please slowly state and spell your name for the record if you wish to make public comment.
Hey there, Brady Easterling, Brady Easterling. I just want to say ditto to what Carter Bundy just shared.
Thank you.
Thank you. One moment, we have a couple more. Caller with the last four digits, 6403. You have been unmuted. Please press *6 to unmute if you wish to make public comment. Caller with the last four, 6403. You have permission to speak if you wish to make public comment. Caller with the last four, 1662. You have permission to speak. Please press *6 to unmute your phone, and please slowly state and spell your name for the record if you wish to make public comment. Call it with the last four, 1662. Please press *6 if you wish to make public comment. Chair Rob, that is everybody. That concludes public comment. Oh. Chair Rob, you're on mute right now.
Sorry about that. We all do it at one point. We will move on to agenda item number 3, budget closing update for Rich, Executive Officer, for discussion.
Thank you, Laura Rich, for the record. And I apologize. This would normally come in the form of a board report, but our budget closing was on Wednesday and we had to get these items posted by Thursday. So this is just a verbal update. As you heard, we have had our budget closing on Wednesday morning, and there's some good news. We did get some additional HSA and HRA funding for all active employees. This is all done through general fund, so it is not through the PEB budget. This is through the biennium funded by the legislature through general funds. It was tiered, so the tiers are in $300, $400, and $500 increments. So $300 for employees, $400 for employee plus spouse and employee plus children, and then $500 for employee plus family. So that's in addition to on the CDHP, there's already a base amount, and then the PEB board approved $300 additional for all plans. And so this is in addition to that $300 for all plans. We're adding that $300, $400, $500 tiered based on what plan and what tier that person's in. So that was good news. Additionally, we have as you heard through public comment, life insurance was restored again through general fund. And so this is not through our budget. So this is done for the biennium without the promise that this is going to be continued in the next 2 years when the subsequent GovRec comes out for the next biennium. So this is done through the legislative process outside of our budget. The restoration of life insurance was it was restored to the $12,500 for retirees and $25,000 for actives. Another good piece of good news, we did get the lead insurance counsel position approved. So that's currently we have a CIO position that has gone unfilled for quite some time now, and we asked to switch it and to reclassify it to a lead insurance counsel position. And so that has been approved. I'm really excited about that. That position would begin on or after July 1st. And the last piece of this is our subsidies. So our Aegis and Reggie, as was submitted in our budget, they were approved. And so while this is not guaranteed because they're projections based on our current trend today, the subsidies are set with the expectation of keeping rates flat or relatively flat throughout the biennium. So we are glad that those rates, those subsidies as submitted were approved as well. So I think that really captures it in a nutshell. And if the board has any questions, I'm willing to answer them.
Don't see anybody raising their hands with questions. Not seeing any questions, we can move on to agenda item number 4. Discussion of possible action regarding 2023 legislative bills that may impact the public employee benefit program, including the following. We'll start with assembly bills, then move to Senate, then move to bill draft requests. Laura Rich, Executive Officer, so we'll start with assembly bills and then we'll take questions.
Rich for the record again. In the interest of time, I know it's a Friday afternoon. A lot of us have our brains basically shutting down. So I'm not going to go through every bill here. I don't think it's necessary to go through every bill. I've tabbed some of the bills that I'm going to go through that I think are important to cover. But if there's any board members that have any bills outside of this that would like to they'd like to pull out, I'm happy to go over those. So the first one, I could not remember if at the board meeting or if it was can't talk today, if at the last board meeting, we discussed on page 3, AB6. So this is as part of my position at PEB, I am a non-voting member on the Patient Protection Commission. So PEB has been participating in providing data regarding claims data and doing cost analysis with the Patient Protection Commission with the intent of potentially the Patient Protection Commission wanted to look at establishing a benchmark, a growth cost benchmark. This is not being supported by the governor's office, the new administration. And so although this bill is continuing through the legislative process and was passed out of the committee, it's something that the administration has come out publicly and said that they do not support moving forward. And I couldn't remember if I had said that at the last board meeting or not, so I just wanted to touch on that. The next one, if you turn to page 6 of the report, this is AB 85. We did go over this last time, but it has since been amended. This is a bill that establishes fixed rates on facility charges and establishes an independent commission to oversee those rates. So when that commission looks at what is fair and reasonable for facilities to charge, they can look at things like what is the going market rate, what is reasonable profit, things like that, to establish those rates. Originally, this was going to be done statewide, but the amendment narrows the scope to basically PEB. So PEB, it's somewhat of a pilot program in this bill. At the time, it's really, we're unable to determine what that impact would be. Originally, we had thought that it would likely reduce rates, assuming that we are that there's room for those rates to drop and that hospitals are overcharging. However, there's also the thought that, you know, if you hear the hospital associations, they've had plenty of presentations that they have made publicly. A lot of hospitals are claiming that they are in the red right now, and they're not making sufficient, they're not bringing in sufficient revenue in order to cover their costs. So if that is true, the opposite could be true, where we would be paying higher rates, right? So it's really we're unable to determine what this is going to look like. But that's essentially, what that bill boils down to. It was passed out of committee and is now in the Senate. So we'll be watching this, but as of the last board meeting, the board position was neutral. So if there's any thoughts or changes on that, this is the time to speak up.
Do we have any? Oh, yes, Ms. Aiello.
Just a quick question. Is the hospital association in favor of this?
Absolutely not.
Then my thought might be that they don't think it would increase the rates, but that's just a thought.
I think there's a lot of, Rich for the record, there's some complexities to this, right? So there's a commission that would have to be established that would look into those rates. And what does that look like? I mean, you really have to look at, the hospitals and figure out, dig into their, finances, really. That's what I would assume. You'd have to look into their finances and figure out what are they charging versus are they, what is a reasonable profit, right? So I don't know if anybody really understands, what that would look like, including the hospital association. So I don't think that there's sufficient information. It's always good, to get this data and to really understand what is, happening in terms of, what charges are, what claims are looking like, and we were doing this through the Patient Protection Commission is collecting that data. And we're also doing this through price transparency and things like that, and all payer claims databases. So there's a lot of efforts being made to get the data, but we just don't have that data yet. So it's really difficult to say whether this is something that's good for PEB or bad for PEB.
And then that would be a good point if people, including the hospital association, really don't know the impact of this. That seems a bit early to institute it, but just a thought.
Board Member Kelly.
Michelle Kelly for the record. Thank you, Chair Rob. I'm a big fan of remaining neutral on these legislative bills, but I'm really concerned that this one has been amended to only focus on PEB. I don't think we should be used as a guinea pig group, we or our employees, firstly, because as Executive Officer Rich has pointed out, there's so much unknown about this. I think that so much money and lobbying money goes into the medical care in this country. Honestly, it probably will reduce prices, but if PEB's not staffed to do this, and now it's only PEB, I kind of think that we probably should take a position. And also I think that just a small group like PEB, how are you going to impact I don't think we're a good group for the experiment, if you will, because it is a closed group. We already have our own negotiated rates. And how will that impact our contracts with, our networks and things? I think that I actually think that it could be just very burdensome to do this. And so I would make a motion to actually position ourselves in the negative on this one, if anyone else was interested in seconding it.
I have a motion by Board Member Kelly. Do we have a second? Tom Verducci, you're on mute. You second?
Yes, Tom Verducci, and I will second that.
Okay, thank you. Any further discussion on the motion? Seeing none, all those in favor signify by raising your hand and saying yes.
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 Yeah.
Okay, all those opposed, please signify by raising your hand and saying no. Okay, motion passes.
All right, Laura Rich for the record. If you turn to page 11, you'll see Assembly Bill 250. This bill establishes provisions governing prescription drugs. And so what this is, it's really, it's tying the Medicare, the Medicare pricing, right, to, the moves that Medicare has made to drug pricing. Again, this is one of these that it's difficult to determine how this would impact PEB, because it could overall lead to net savings, depending on what those negotiated prices are, because CMS hasn't done that yet, right? CMS is, we're still some time out before that, that happens, on the CMS front. So we don't know what those negotiated prices are or which drugs they are. We have a pretty good idea of which drugs they are, but we don't know exactly which drugs. And so depending on what those negotiated prices are compared to what we are actually paying through our PBM, we could see a cost savings or not. The other thing too is that this bill could result in less favorable discounts, right? So you lower the cost for some drugs and they're going to make up their cost somewhere else, right? And so other drugs that are not on that list will get will increase in price. And so you'll see other drugs go up in price. So in the end, would we really save anything or not? We don't know. The last piece of this is that there's downstream considerations as well, such as if other states that are not doing this, versus the states that are doing this, potentially access to those drugs would be directed and much easier to access through states that don't have it versus states that do. Whether that would happen or not, who knows, but it's something that we have to take into consideration. So this was passed, and and there was an amendment, some small amendments, but overall that's the gist of this bill. So we don't have a board position on this. If the board would like to take a position on this bill, this is the time.
Any comment amongst the board members? Ms. Ayala?
Sorry, I keep jumping in, but again, it's hard for me to jump on board on things so early that we don't know what the impact is. If CMS hasn't come together yet and established these pricing and seen what's going on, it seems like we're, I don't know, jumping into a hole before we know what it is. But maybe I'm just worried about those kind of things.
Any further discussion? Seeing none, I think we can move on.
All right, turning to page 15 of your packet is Assembly Bill 383. This bill expands health insurance coverage to include voluntary sterilization for men, clinical services related to contraceptions, and language translation services that facilitate the provision of contraceptives. There's a lot of contraceptive bills out there right now. This is just one of them. This does not affect PEB because one, there was an amendment which really eliminates all health insurance coverage. So we would be exempt from this, but for the most part, we're already providing these services anyway. Language translation, probably not. I don't think that's covered in our plan, but for the most part, we do cover the sterilization for men and some of these other contraceptive coverages that are discussed in this bill. So there should not be any fiscal impact or really any impact whatsoever to PEB on this one.
Any board discussion? Seeing none, we can move on.
All right, Senate Bill 163, this is on page 21 of your board packet. This requires certain health insurance to cover treatment of certain conditions related to gender dysphoria, gender incongruence, and other disorders of sexual development. Really, there were some changes in here that there was an amendment in here that I just wanted to bring to the board's attention because for the most part, I think we've already, discussed all this, that we do provide most of the coverage that is included in this bill with some minor benefits that would be really insignificant in terms of, nominal to the plan. The only update that I want to bring to the board's attention is that PEB currently uses utilization management, which takes into account the WPATH guidelines. But that's just one piece of how they make the determination for gender dysphoria coverage. What this bill does, the amendment actually now requires insurers to use WPATH, whether that means that they only use WPATH or they use it as part. It's not quite determined yet. I haven't figured that out quite yet. That the amendment was just adopted on the 13th. And so this is probably something that needs to be clarified. But I just wanted to make sure to bring that to the board's attention because that's not currently the way that PEB does it today. We take WPATH standards into consideration, but we do not, that's not the only guideline that we use.
Okay, any further discussion or questions? Seeing none, we can move on.
Right, the next one is on page 22, which is Senate Bill 167. This is the bill that you heard some public comment about earlier today. This bill requires a plan to allow members prescribe certain psychiatric drugs to bypass step therapy. We discussed this last time the board was in a neutral position. Our fiscal note at the time was fairly minimal. It was $20,000 a year or $40,000 for a biennium. There was an amendment to this that removes step therapy requirements for any FDA approved drug. So this means that it is now not limited to just our formulary drugs, right? It's any FDA approved drug. And so it does kind of open the doors a little bit and definitely has larger impact than that $20,000 to $40,000 or $20,000 a year or $40,000 a biennium. That's now increased to about $150,000 a year of an impact. Now, I did have discussions with the stakeholders that are involved in this bill, and there were some comments made about potentially what you heard through public comment, right? Through step therapy, you potentially if you provide someone access to the drug that was originally prescribed, you may end up preventing hospitalizations, whether it's an ER visit, whether it is, another type of event. It does provide, you can make the argument that it does provide it does reduce potentially those types of incidents. Now, I did actually reach out to our utilization management team and ask them, again, we've only been using United Healthcare for our utilization management for since July 1st, right? So there's not a long period of time to look at this, but I did ask them to look into this and see if there was any type of situations or scenarios that they could think of where they had someone in case management undergoing behavioral health type services, and because of step therapy, they were not on the right drug, which landed them either in the ER or hospitalized for any other reason. They didn't have anything that they could provide to me in terms of data that could prove that. Not to say that's not, it's a logical argument, but I don't have data to prove that. What I do have though is that those drugs definitely, the expansion of those drugs would definitely come at a cost. So with that, I'll take any questions.
Mr. Verducci.
Yes, Tom Verducci for the record. I personally have had to help somebody for the last 5 years that has come down with a severe case of schizophrenia. And this individual has tried to take his life 7 times, 60 days in the Reno Behavioral Center. And from hands-on experience, I can tell you if they're not taking the right medication and they have an episode, it gets really, really severe. And I think that that in general, mental health is something that does get ignored a little bit. I do think that we should be taking some position to give them the very best access that they have to their medications. And I do believe that we've heard enough compelling public testimony that I do think this would be in the best interests of the members for us to support this.
Board Member Ayala.
I just have a question how this relates to SB 194, because when I read that, it talks about step therapy, and then down in the impact to PEB, it talks about drug costs also, and that has a huge fiscal note of 1.5 million. And I'm just curious because if we, and I kind of agree with what I just heard from Mr. Verducci, but I'm just trying, if you could explain how these two bills relate and what doing something to one impacts the other or not, just so I can better understand. Thank you.
Sure, Laura Rich for the record. So SB 167 is limited to psychiatric conditions, whereas I think 194, if I'm right, is much more of a broad scope, right? So this is much more limited. 194, we are, we'll go over it, but we are exempt from that. PEB has been exempt from that one. So that one no longer applies. However, that bill in general does have a much broader scope. Well, this one is limited to just psychiatric conditions. So there's only a certain type of drug that would be that would not be subject to step therapy.
Then I'm just a little confused about that amendment adopted on April 5 that says remove step therapy requirements for any FDA drugs. So it removed it for all and just made it to psychiatric drugs. Is that what
correct? So originally, the way the bill was originally written was it was the covered drugs, right? Those covered psychiatric drugs that we offer on the plan. So formulary drugs. Now this is kind of increasing the scope to even non-formulary drugs. So we were neutral on this bill. If that's where we want to remain, or if we want to change that to support, that's something that the board needs to decide.
Board Member Verducci.
Yes, I'd like to make a motion that we support SB 167.
Ms. Woodward, who was second?
I'll second that.
Okay, we have a motion and a second. Any further discussion? Seeing none, all those in favor signify by saying aye.
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 All those opposed?
I'm opposed.
Motion passes with Board Member Fox opposed. Okay, we can move on.
Okay, the next one is Senate Bill 184, which we just covered, so I will just briefly go over it. Really, this just the amendment on April 12th explicitly removes PEB from this bill. I don't think that the senator had any intention of including PEB, but the way it was written was not clear. And so the amendment specifically excludes PEB and removes them from being the requirements of this bill.
Hey, any further discussion? Seeing none, we can move on.
All right. The next one is Senate Bill 320. So state legislators right now do have access to PEB coverage. However, they do not get a subsidy, so they are footing the entire bill, which can be pricey. So Senator Harris has proposed this piece of legislation, which does basically make a legislator have coverage similar to an employee. They would get that same subsidy that any other employee would get, and have the same plans, et cetera, right? So no change other than they'd get that subsidy. There is no cost impact to PEB because the employer, in this case, it would be the Legislative Council Bureau, would pick up that cost. They're the ones who are paying for that Aegis and Reggie, which is the subsidy. So there is no impact to PEB. I just realized right now, it looks like the board already took a position on this. So I must have already gone, I must have already gone through this last time. There was an amendment that was proposed on the 14th. And basically it's just so it's constitutionally sound, where an elected official has to be reelected before they can actually take advantage of this. So someone can't vote on a law that's going to benefit them, right? And so this just changes it so that they have to be elected starting November 5th of 2024 moving forward. So that's the only change to that one.
Okay, any discussion? Seeing none, move on.
This is the next one is on page 29, which is Senate Bill 330. I just wanted to bring up that there is an update. So again, some of these bills are written kind of, they're a little convoluted as to whether it applies to PEB or not. And so we were able to clarify that Section 8 of this bill, and this is the mammogram bill that we discussed last time. It extends coverage to all members and removes cost sharing. So Section 8 of this bill specifically does exclude PEB. We were in support of this. And so if this bill should pass, we might want to discuss whether or not this is something that we want to adhere to in the future, or take advantage of the exemption. So this is just something to keep on the radar.
Okay, any discussion? Seeing none, we can move on. Oh, go ahead, Board Member Woodward.
Sorry, Janelle Woodward for the record. I just wanted to clarify, you said this excluded PEB from this one? That's too bad. I hope that we consider it in the future.
Okay.
So the next one is on page 30. That's Senate Bill 352. There's quite a few PBM bills out there right now as well. This one really, we already adhere to much of what's in this bill already. There's some provisions regarding the drug coverage and contraception and things like that. But there's definitely a amendment that now there's a noticing requirement through this amendment. Since this was posted, I was able to get confirmation from our pharmacy benefit manager that there will be, some minor complexities with the noticing requirement, but it should be fairly minimal, and we should be able to adhere to it just fine. So we don't have any real concerns with this one.
Any discussion? Okay, seeing none, we can move on.
On page 31, Senate Bill 377. This is a bill that requires the executive department, so all agencies, to designate certain information and documents as vital documents. And those documents would then need to be translated and made available in certain languages. This means that PEB would have to actively translate all significant documents, those are our master plan documents, our SPDs, our benefit guides, things like that, in the top 12 languages spoken in Nevada. So we were able to do some quick math based on the contracts that the state currently has available for translation services. And we're looking at a pretty hefty dollar figure here. It's about $1.5 million per year because we'd have to have it translated every year. So this is one that we have not taken a board position on. If this is something that the board would like to take a position on, I'm happy to hear it.
Any questions or comments? Board Member Aiello, and then we'll go to Board Member Biddleson.
Just really quick, and I appreciate the work you did on coming up with this dollar amount, but if it was translated once, all of the documents for 1.5 million, then wouldn't only the updates and changes in the document need to be translated? So if there's only a few paragraphs in the future, it wouldn't be the, just wondering, because that sounds like a lot yearly.
Laura Rich, for the record, potentially, yes. It just, you know, you want to cover your basis when you translate something. I know I speak Spanish fluently, and I know you can't translate things word by word, word for word. And so sometimes if you switch certain things up, you have to translate the whole phrase. And so there's potential to just, you know, say, here's our master plan document, translate it. In years that maybe we have a lot of changes, but in years where we don't have a lot of changes and we're just changing maybe, you know, the dates and things like that and just minimal things, then that would make sense. But you have to present kind of not really a worst case scenario, but you know, what a realistic expectation. And I definitely think, you know, PEB has some vital documents, but I think our fiscal note compared to what other agencies might be providing is probably minimal because I think other agencies have quite a few more documents that they would have to translate that do change year by year.
Okay, Board Member Biddleson. And then
Thank you. Just a couple of questions. So what is PEB doing already around translation? Are we translating documents into Spanish or are we doing that already? My second question is, does a vendor do this? Is there a vendor that does translate into all 12 spoken languages? I just asking to see if that's even possible.
Laura Rich, for the record. So by law, we do have to have it available. So if someone asks for a significant, so it's got to be a vital document, a significant document. So that's our master plan document, SPDs, benefit guides, things that are major. We are required to translate them, to have them translated if the request is made. I don't know, and maybe I see Mr. Lindley who's unmuted himself. I don't know if we've gotten any of those requests, but Tim, do you want to speak on that?
Tim Lindley for the record. We haven't received any requests to date, but the difference between current requirements and this legislation is this legislation requires proactive translation of documents, whereas today they just submit a request, we get it translated right away and provide that to them. We do use the state contracts for document translation services, so we don't have someone in-house manually doing it. We do have to go through the contracts route.
okay, Mr. Verducci, do you have an additional question?
Yes, I do have a question. This is Tom Verducci for the record. And I think I'll maybe point this to Tim. I think Tim might be able to answer this, but I am kind of wondering where the $1.5 million biennium cost comes from. Is this going to be generated from work on the PEB staff? And I have a concern about additional work on the PEB staff, being that I believe our statewide vacancy rate is right now around 25%. And I just don't know if it's creating more work and expense that is really necessary. I know when I need to translate something, I just go to Google Translate, but I understand the concerns on the various translations and how many requests really come in for the 12 languages.
Tim Lindley for the record. To answer your question, as mentioned earlier, we would go through a state contracted vendor. So we wouldn't really have much work per se. Once we have the plan documents finalized, we would then send it off to the vendor for translation and to provide a final document. Then those would get posted online accordingly.
So does that appear accurate? $1.5 million cost to the plan, the biennium?
Laura Rich, for the record, yes, Mr. Lindley actually did the math. He counted the words in all of the documents, and it is per word translation. And so we did the math, and that's where that number comes from.
So do we have any idea in the last 2 years, say, just on the average, how many requests have come in for this translation?
Laura Rich, for the record, I don't know of any that have come in the last couple of years. I can't think of one in the 7 years I've been at PEP.
It almost seems like a little red tape here, and there's a pretty big price tag, $1.5 million. I'm just trying to see where it's going to benefit somebody, unless it's an issue out there that is creating problems.
So I think, Laura Rich, for the record, I think the intent of this legislation is to ensure that government in general is able to communicate with non-English speakers, whether it's Spanish, whether it's Chinese, Mandarin, whatever it is. The thing is with PEB, we don't really, we're not really dealing with the general public, right? We're dealing with state employees and retirees. And for the most part, I would say you might have some non-English speakers, but I think for the most part, state employees are, have a pretty good grasp of the English language.
Okay, it was the yes, it was the $1.5 million fiscal or biennium impact here that was disturbing, but it really doesn't seem like this is going to be a really big impact on PEB, but I'm leaning towards us remaining neutral. Just my thought.
Well, Richard, it would be a requirement if this bill passes. It would be a requirement on PEB. It doesn't mean that we don't have, because we'd have to proactively do it. Right now, we have to react to it. If there's a request, we translate. But this is a requirement that we would have to do proactively.
Board Member Isle.
So Laura, right now, the law is that you have to do it if someone asks. But to PEB's knowledge, nobody has asked for 7 years. So if this were to pass, PEB would maybe be, I still don't think it would be 1.5 every year, but PEB would at least be taking on 1.5 million in the first year, and then whatever amount every year to update it afterwards. And I don't know, with the idea that PEB is pretty much for people that have worked for the state. Now, maybe some family members don't speak English that are enrolled in the plan, but there should be someone linking them, I would think, that would speak English, and maybe that's why you haven't gotten any requests. Is there a potential for PEB to be amended so that it didn't require for PEB? I don't know, or if they think that would just look bad, but here we're looking at actual medical services that we're sometimes not asking for because of that cost. And this is something that we will do if someone asks. I don't know. Just
Board Member Kelly.
Michelle Kelly for the record. Thank you, Chair Rob. I think I'm as challenged by this bill as everyone else who's made a comment. I think just because PEB hasn't had a request for it doesn't mean that there's not the need out there. That's, I think, some of our lower level jobs, custodians and things like that, they don't rely on their language skills to actually do the job. So I do agree that there's probably family out there, for those people who do have challenges, who have been helping them. So saying that, Executive Officer Rich, is this the 1.5 fiscal note, is that attached to the bill already? So you've already provided that to the legislature?
Correct.
Yeah, personally, I think I'm comfortable staying in the neutral position on this. I think the fiscal notes let the bill sponsors know the cost of the idea that they've got. It would be great, I think, if PEB could get exempted. But at the same time, I think that just because there hasn't been a request doesn't mean the need's there. I just don't know. I'm the same as everyone else. So that's my thoughts.
Okay, any further discussion? Seeing none, we can move on.
Okay. Moving on to page 34. This is Senate Bill 431. This is the governor's bill. For those of you who are not aware of what is included in this bill, I know Chair Rob definitely is, since he's very intimately involved in all of this. There's a lot of HR changes that would affect not just PEB, but the state in general, that are included in this bill. So first of all, the legislation creates 5 cabinet level positions, each one overseeing certain areas of state government. The PEB oversight would fall under the Secretary of Commerce and Administration. So just so the board's aware, today we have today and historically, the agency heads have been appointed a liaison at the governor's office, whether that's the chief of staff, the deputy chief of staff, or anybody else, in that governor's office. So the problem with that is that those positions are there to govern, and they're really instead focusing on putting out fires within the state government, within state agencies. And, from a director perspective, and I've mentioned this to the governor's office too, I've been very forthcoming. I think that this helps because from a director's perspective, sometimes you need guidance. You want to make sure that you are aligning with the goals and direction of the governor's office, and that you're not going against, as an executive branch agency, against what the governor's office is, their intentions. And so when the governor's office staff is so bogged down that it is difficult to really, to get their time and attention, it's difficult on directors as well. They do their best, but there's a whole lot going on in that governor's office. And so I think that these 5 cabinet level positions would be a great addition. I don't know if they're going to get them or not. The other part of this is it makes a lot of HR changes that do expand on the authority that agencies have. So right now, for lack of better words, there's a lot of red tape. Anytime agencies want to do something, there's a lot of steps, and there's a lot of, you've got to go through a lot of different places before you can actually get the final okay. So this actually takes away a lot of that bureaucracy and puts it on the agency. And so things like, for example, including or having the ability to start employees at a higher pay range. So instead of step 1, let's say there's an employee who comes in with more education, more experience, and you think that they they qualify for step 5, and you can bring them in a little bit higher than entry level. And so in the past, there's been a whole lot of steps that you have to take in order to get that approved. And I will be honest, most people don't even bother going through that process because it's such a headache. And half the time it's denied. This would change it so that if your agency has the money and the appointing authority thinks it is worth bringing in that employee at a step 5 instead of at a step 1, that it leaves it up to the appointing authority. And so there's a lot of that, the decision making gets pushed to the actual agency versus others at other agencies. So I'm very excited about this, and I don't know, Director Rob, do you want to, or Chair Rob, do you want to expand on anything that I didn't include or didn't touch on this bill?
No, but I truly believe that the changes in 431 are going to make government more efficient and make the hiring process more efficient. And I think everybody's aware that Smart 21 was canceled. And with the cancellation of Smart 21, the rollback, I can tell you Smart 21 is a barrier to state employment also. So we're trying to simplify the process, trying to put the decision makers back, the decisions back to the people that know what they need, instead of running through HR that has this matrix they have to work in. We're hoping to change our 24% vacancy rate and get that down considerably. Board Member Kelly, do you have any comments? Oh, you're on mute.
No, I'm sorry, I don't. My hand's still up from the last time. I'm sorry, no, I don't have any comments. My hand was still up. I apologize.
Sorry about that. I was muted again. Board Member Verducci.
Thank you, Chair Rob. You know, I'd like to throw a motion out there to support this one. I like what I just heard, and I think it's beneficial for the state, and just want to put my name behind supporting this. That's a motion.
We have a motion. Do we have a second?
This is Betsy Aiello. I'll second it.
Okay, we have a motion and a second. Any further discussion? Seeing none, I'll call for the vote. All those in favor signify by saying aye. Aye.
Aye.
All those opposed? Motion passes. Thank you.
And the last one that we're going to look at, Laura Rich for the record, is on page 38. This proposes to amend, its SJR 7, proposes to amend the Nevada Constitution to establish certain rights to reproductive health. This is sponsored by Senator Cannizzaro, and it proposes to amend to guarantee a fundamental right to reproductive freedom and protection to providers from prosecution. Overall, this bill does not impact PEB. It's not a direct impact on PEB. However, I think it might have some positive effects on access and provider availability within the state. I do know that there are in the states where abortion has become illegal, there's a critical shortage, or there's quickly becoming a critical shortage of providers, that OBGYN providers, and we already have a shortage of that to begin with. And so I think that this move could potentially impact the provider availability within Nevada should this bill pass, because it does provide protections to providers. But it won't have any direct impact on PEP.
Okay, any discussion on SJR 7? Seeing none, we can move on.
That is it. That was the last one.
There is no BDRs. Everything died from not moving out of first house, so we're good. With that, we will close agenda item number 4 and move on to agenda item number 5. Public comment.
One moment, Chair Rob, I'll get the slide up. For those who have joined for public comment, your name or last 4 digits of your phone number will be announced, and you'll be advised you've been unmuted. As a reminder for those on the phone, please press *6 to unmute. Please slowly state and spell your name for the record and proceed with your comments. Due to time consideration, each call will be limited to 3 minutes. Brady Easterling, you have permission to speak. Please slowly state and spell your name for the record if you wish to make public comment.
Hey there, no wish to make comment at this time.
Thank you.
Thank you.
Chair Rob, that's the only one we have for public comment right now. If you want to give it about a minute, just in case someone else wants to jump in.
Yes, we'll give it just a minute.
Sounds good. Thank you.
All right, I don't think the delay's that long on YouTube. It's been getting closer. So with that, I will close public comment and we can move on to adjournment, and we will adjourn. Thank you very much, everyone, for your time.
Thank you.